to the HMPV virus that is now being detected. A case of HMPV has now been detected in an 8-month-old child at a private hospital in Bengaluru. The kid has no travel history, however, has tested positive for this virus. Now, tests carried out at the hospital lab has confirmed HMPV positive. Now, Karnataka Health Department has, with the information conveyed to Union Health Ministry quickly enough, that Karnataka Health Department has said likely to wait for further direction from ICMR and Union Health Ministry. Well, these are the latest inputs that we're tracking from the ground, and joining us for a better perspective into the entire situation is Harish, who's getting us more details from the ground. A very good morning, Harish. Harish, what more details are we gathering on this recent case of HMPV virus that has now been detected from Bengaluru?
Well, this is a 8-month-old kid who's being treated at a private hospital in Bengaluru, and what we understand is that the test that was carried out at the hospital has come positive for HMPV virus, and this has been conveyed to the State Health Department, which has in turn got in touch with the Union Health Ministry and the ICMR, seeking further direction on how to act next, whether this sample needs to be sent to NIV Pune for genome sequencing and further tests, or whether there are additional measures that need to be taken, or if there remember, this has been tested at a private hospital lab, so they've also checked with the union government on whether this has to be now tested at a government lab, which has been used for COVID and other virus testing. So that is something that they're waiting for the union government to respond. Remember, one thing that has to be highlighted here is that it is still not very clear the kind of strain that is causing the spike in China, the strain of HMPV and structure of it. That's something that is not readily available with labs in India or with the various state health departments. So they're waiting for that information as well to cross-verify on whether this HMPV positive case from Bengaluru has a similar strain that is causing spike in China, because this girl, this 8-month-old child, hasn't traveled, has no travel history as well. So they are waiting for more specific directions coming in from the ICMR and the Union Health Department.
Right. Harish, help us also understand how might this incident which is coming to fore impact the national conversation around this pandemic, its preparedness and the response that the Union Health Ministry also needs to take?
Well, three aspects that needs to happen very quickly. To gather more information on the exact strain that is causing the spike in cases in China, because then you have a reference point. Because many experts that we have spoken to from morning are saying that there is a possibility that HMPV virus was already present to a certain extent and wasn't seen as a virus of concern, or wasn't even being reported or monitored. And there are several pathogens like that which don't really get monitored, which cause a few cases here and there. Does India now need to take some sort of action to check all the tests and monitor this particular strain? This is something that, this information is something that needs to go to all state governments for better monitoring mechanism. Obviously, all the doctors and the experts saying that there's nothing to worry at this point in time.
Right, Harsh. Thank you so much for bringing in all those details from Bengaluru. But we are now shifting our focus to